And we're live here at the innovation stage. My name is Shashank Sinha.
And I am Taslim.
And we're from the Fits on the Go. And we have the pleasure and privilege of interviewing Dr. Bob Harrington, Chairman of Medicine at Stanford University today. How are you doing, Dr. Harrington?
I'm doing well. Thanks for stopping me.
Absolutely. Well, we wanted to talk with you a little bit about the inception of this ACC Journal Club. It's kickoff at the innovation stage today. Tell us a little bit about its conception and implementation.
So within the college, there's a group of the members who are part of the education team. And we're always looking for ways that we can help educate our members in ways that are helpful, of high quality, and easy. And one of our Board of Trustee members, Mike Valentine, several years ago suggested, why don't you do a journal club that you could give the members credit for? He said, we all love journal club. We like going to talk about an article, and why don't a small group of you run a journal club just like you would for your house staff or your fellows? Great idea. Fast forward a couple years, and I think what really pushed it at this point was the maintenance certification issue, is how do we give our members as much credit as possible for the things they already do, that they like to do, and help them meet the ABIM's requirement for maintenance certification. So that's where it came from. And so we're launching it at this meeting, and what we'll do from here on out is once a month, there'll be a small group of ACC members who will lead a journal club over the web. At the end of the journal discussion, you'll have the opportunity to answer 3 MOC questions. At the end of a year, if you've done 10 journal clubs, 3 questions each, so 30 questions, you'll get 10 MOC points. Now put that into context. You need 20 now every 2 years. So if you just did journal club once a month, answered the questions, you'd get your 20 points. Pretty good deal.
So, what do you think? Like, how will it help and benefit the fellows? What advice do you have us to have to?
So remember, for the fellows, once you pass the boards, you have to be enrolled in maintenance certification. That's the new requirement as of January 1st. And so even old timers like me, we have to be enrolled in maintenance certification. New board passers like you guys, you'll have to be enrolled. And so you're going to be looking for things that you like to do, and I'm going to guess that in your own programs you go to journal club.
Yes.
Yeah.
And how about coming to the simplicity? What do you think about the recent results, which have been very positive? And what do you think about it?
Yeah. So we covered simplicity. We only decided over the weekend which journal which paper we would cover today, because as you know, it got presented on Saturday. Here we are on Monday. We thought that the members would probably like several of us to walk through the design, the results, and maybe generate some discussion. So what do I think? I think it was a very well done trial, very rigorously done. You saw, it was blinded, had a sham placebo, really rigorously done. The patients were carefully selected, carefully followed. A well done trial. And there was no effect.
Okay.
So, I would say that should make people take pause and really rethink things. And it doesn't mean we should stop, but we should at least rethink things.
Can you give us a hint as to the next journal club topic?
Well, I might as well say it, because we were just discussing it, and I think we've picked it. This is tentative, so we'll call it a draft selection. We think we're going to do the core valve randomized trial of valve versus surgery, percutaneous valve versus surgery for patients with severe aortic stenosis. So stay tuned, check CardioSource, and see if that's the one we stick with.